heed the warnings and follow the guidelines and the mandates. The only way we're going to get ahead of this is to do that. It's a short-term sacrifice for a long-term gain. The more we can do that, the better off we're going to be. The less trouble we're going to have down the road. We live and are fortunate enough to live in a country where our freedoms are very dear to us, and I understand it's hard to do that, but I think for all our sakes, it's going to be the thing we need to do. So again, all of this information was important, but I would suggest and I would ask the press to make sure that you emphasize the fact that the guidelines and the mandates, although cumbersome and difficult, are what's going to get us through this or lessen the likelihood of this being a bigger issue.
We do have one confirmed case of COVID-19 in Genesee County, and again, this person is of the age above 65 and was confirmed today on March 17th, 2020. The individual was in mandatory quarantine once they became symptomatic, and they have remained there and have been very compliant. We've been checking on the person daily, and now they are under mandatory isolation.
And you mentioned there's 2 other people under mandatory quarantine right now. Is there any indication that these 2 individuals had contact with the person that's now confirmed?
No, at this point they are separate cases or separate quarantines. Again, this is late breaking, so we're right now starting that contact tracing. So at the moment, these are separate individuals, again, that have met the definition for mandatory quarantine.
And I know it's early, you may not have this information yet, so it's a 2-part question. One, what do you know about what contacts, where this person might have been in the community prior to going into quarantine, because he was probably a carrier before that? And 2, will you release information to the public once that's known so that people might know that, hey, I was at X business on that same day?
Yeah, so again, we're just building the story, right? So part of epidemiology, when we get these confirmed cases, we have to go backwards, right? We have to try to identify those, and we are literally making those calls as I'm speaking right now. So I really can't comment, with any validity of where the person may have been prior to becoming symptomatic and actually where they were in the community. At the moment, we will again be assessing and looking at where the story takes us, because right, we have to investigate this and try to figure out and build those contacts. Obviously, you've seen in other cases in surrounding counties, depending on unknown, if they were at an event, at a church service, at a faith-based event, if they were at another community event. Those are areas where there would be more of a global ask, right? If you happen to have been at that event where we don't have specific information on the people there, where we would look to the public to maybe come forward and potentially be, again, case contacts.
A question I didn't get a chance to ask yesterday, I'm sorry. A question I didn't get a chance to ask yesterday, and you talk about, building the case.
Mm-hmm.
How are you on staffing to deal with, doing this investigation to find those contacts? And then also on the quarantine, I think isn't there a process where you go daily and collect swabs to check if how's the staffing on that?
Yeah, so I appreciate the question on the staffing. My staff back in the health department, they're first class. We have great folks that are working for our counties, not just in the health department, but from all these departments and folks that represent you. They work daily to protect and to provide services to our residents. They're holding up. It's been busy. It's been busy this last couple of weeks, particularly when we started seeing cases here across New York State and now cases locally. They're working very long days and they're doing their job, and they're happy to do their best to protect our residents and make sure that you guys have the most recent and up-to-date information. But it is something that we're monitoring and making sure we're trying to, again, keep those in mind. We want to avoid burnout. We want to make sure that they're staying healthy. Another big concern, obviously, is if you have, some exposures or some cases in any of our staff, but particularly those that are responding on the front lines of this, that can become problematic. So we're really working hard to keep our folks healthy, to keep them with the energy and the stamina to be able to respond to this over the next few weeks and months. The second question was?
Well, do you do swabs on people in quarantines, okay, and how's the staffing on that?
Yeah, so as far as the swabbing, we do not. So when you're in quarantine, you're well. You're not symptomatic, so to speak. So we are not doing swabbing on those folks. What we're doing is mandatory daily checks if it's a mandatory quarantine. And we are going out there once a day We're verifying that they're being compliant with the quarantine. We're also calling them once a day. And when we do that, they're checking their temperature. We're asking them if they have any type of respiratory symptoms. And that's how we're monitoring. If they report that they are symptomatic during that quarantine period, that's when we would swab them to see if it is COVID-19. And then again, if they're positive from that point, they move over to mandatory isolation. So the question was around the person in mandatory isolation, the confirmed COVID-19 case, and how long they're going to be in isolation?
Yes.
Okay. So the way this process works now is we're actually following the CDC guidelines in New York State upon clearance. So essentially, it's a minimum of 7 days following the positive test result, and they have to actually have 2 clearance samples after 7 days, 24 hours apart, that are both negative. So if you look at that from a time period, it's going to be a minimum of 8 days. Again, that's assuming they test negative after those initial tests or those initial swabs. They also have to be fever-free without any type of fever-reducing medication.
This person, they have family at home, and talk about how this impacts the family and what they're required to do, or whoever the caretakers are.
Yeah, so fortunately in this case, there are other folks that live. It's a building where there's separate living arrangements. So again, this individual has been, again, under quarantine and separated, so there has not been a contact that we're aware of. Again, we're still investigating a little more going backwards, but at the moment, again, there's no known contacts to others in that dwelling at the moment.
But I think it might be good to reemphasize why this policy is important.
Yeah, so again, what we talked about yesterday, what we've been putting out in our press releases leading up to this, the main goal here is to get folks apart from one another. So obviously restaurants, movie theaters, other places where people gather on a regular basis, again, we have large groupings, 30, 40, 100 people together. And again, what we know about disease transmission, again, airborne disease transmission, if we have folks together, if we have folks congregating, this virus can be passed easily. We know it's within 6 foot close contact. We are hearing, again, these are preliminary understanding of the virus itself, that it can stay potentially alive and airborne for up to 3 hours. So if you think of those different aspects of this virus, it's very hardy. That we need to get folks apart. We need to flatten the curve. We need to push it out. We know we're going to see more cases. I mean, that's to be expected. We've seen it in other communities. We know that the R0 or the replication of this is over 2. So typically, under normal circumstances, when somebody's exposed, they're going to infect at least 2.2 additional people. So with that in mind, the goal here is to get folks apart so we can lower that number, flatten the curve, push it out, and free up our capacity in our healthcare system so we can, again, handle those folks over time.
Is it also safe to say that there is a New York State directive from the executive and an order that talks about establishments, particularly restaurants and gathering places where meals are served, that we are following the guidelines and the dictates? We have not made up our own set of rules and regulations.
Yeah, absolutely. I mean, these are national, state guidelines. Obviously the governor has been changing the playing field for us, so to speak, daily, hourly sometimes. So again, these responses are in line with what he is mandating out of Albany. But again, on the public health side, it is in line with the goal of extreme social distancing.
The governor mentioned today that we're not flattening the curve based on his math. What's your sense of that?
Well, I can't comment on his math. But the reality is, again, we've been preemptive here. This is our first confirmed case. And the goal here was to try to put these extreme measures, these unprecedented measures in place prior to getting cases. Obviously, that's kind of coinciding at the same time. The goal here is that by getting people apart now, if we do identify cases, which is extremely important, to again isolate them, keep them from spreading it to other people, we can hopefully again slow it down and keep it contained. We don't have folks out in the community. Well, the question was around businesses not being compliant, and I think it's important to really say to folks, again, there's different opinions on whether this makes sense, this is overreacting, etc. The reality is this is a directive, this is a mandate, this is what we need to be doing now. We do have local cases now, we do believe it's community spread, and we really are asking folks to be compliant. We need folks to listen and to adhere to the guidance. Again, we talked about yesterday protecting others by protecting yourself. We want to make sure that restaurants and establishments are adhering to these guidelines. You're not doing anybody any favors by going against that guidance. Again, if we're bringing folks together, that is not what we want to be doing. We want to try to isolate, and hopefully this will be short-lived, right? Nobody wants this to be prolonged. We want to be able to move past this, but in order to do that and to flatten that curve, we need to be compliant and make sure we're adhering to the guidance that's put out there. Yeah, so I want to say I hear and I appreciate your frustration. We're frustrated. The reality is, as I've been saying, we are being as aggressive as we can to get these swab kits. Working with Tim and Dale Banker up in Orleans County, we are putting in orders every day trying to get these. And we're not alone. If you look at all the other counties in western New York, we are all screaming for these swabbing kits. And the guidance still is to go through your primary care provider. You got to remember, again, as we continue to talk about influenza, seasonal flu is still prevalent in our community. Just because you have respiratory illness does not mean you have COVID-19. Again, first case, potentially some community spread here, but again, more than likely, most people that are dealing with respiratory issues is not COVID-19. So we want to get that screened out. Providers can still screen for influenza. All right, so they can still check and make sure. So if you get a positive test back for influenza, that more than likely is the result of the respiratory issues. Understood, and I appreciate that, and we do recognize, and that's what we said, when we're able to swab more and test more, we will find more. And we are doing our best. We want people to be as patient as they can. We understand the anxiety is there, and we are doing our best. We will have more information as soon as we can around, maybe community swabbing locations, those drive-through swabbing sites. We're currently developing those and putting them together. We'll have information on where those will be and when they'll be and the criteria. The other thing I would ask is that people continue to be understanding and patient, that we need to really focus on those that are adversely impacted, and that is our elderly, and that is those with immune-compromised health issues. So, if you're healthy and you're symptomatic and you're looking for the swab, we're going to try to accommodate you, but we need to, again, put our resources where we know they're being hardest impacted.
We will unfortunately not be able to process pistol permit amendments, passport applications, DBA filings, or any in-office real estate reportings. All users are strongly encouraged to use our e-filing and e-recording systems. We also have online search capabilities. If you access the Genesee County Clerk website, you can find a link to access our online records. In addition, due to the same situation that we have, the Genesee County DMV is also going to be closed to the public effective tomorrow, March 18th. We will continue to be able to process certain transactions that are submitted either through the drop boxes that we have located on Court Street here in Batavia or in Leroy. Driver's license renewals can also be mailed in. You will need an eye test report, which is a form MV619, or you can visit any vision registry location, and the results of the vision test will be automatically electronically forwarded to the DMV. We do regret that this has become necessary, but ultimately this is in the best interests of both the staff of the recording office and the DMV and the public in general. It's our hope that these measures can be lifted as soon as the relevant healthcare professionals deem it prudent.
Once again, what we're trying to do is deal with the issues as far as some continuity of business, but also providing both some safety with regard to crowds and or gatherings of people, but also with regard to the nature of what our workforce that we're dealing with, because we also have the mandate to reduce our workforce approximately by 50% within the next few days and submit a plan to the state of New York, hence why we will not have the kind of staff that people are used to dealing with in the clerk's office, DMV, county treasurer's office, and also obviously with regard to the boards of elections. In fact, most of their staff, aside from communications technologically and telephonically, will be actually locating out to County Building 2, where all of our equipment and our technology is centered anyway with regard to our voting machines.
City of Batavia, effective 4:30 this afternoon, we have declared a local state of emergency for us, following in the shoes of the national, state, and county declarations. To let you know specifically what that means for us as a city and for you as residents. Number one, the Liberty Center for Youth will remain closed until further notice. 2, all city offices are closed to the public. In other words, walk-ins are not allowed. The city will conduct business with the public remotely. through the use of phones, computers, mail, and other means. These offices are otherwise closed to the public unless a situation requires interaction with a member of the public is determined by the respective city department on a case-by-case basis. City council meetings will be closed to the public until further notice. Provision will be made for the public to observe or otherwise, be able to either see or hear city council meetings as they go on. City parks. City parks remain open for public use, provided that the state of New York declared restrictions on congregating are followed. However, all rentals or reservation uses of city facilities are suspended until further notice. City parks. City parks remain open for public use, provided that the state of New York declared restrictions on congregating are followed. However, all rentals or reservation uses of city facilities are suspended until further notice. This includes parks, sports complexes, buildings, roadways, or public parkways that are owned and or operated by the city of Batavia.
There has been no adverse effects to public safety as far as first responders are concerned, so we continue to provide full level of public safety, first responders in Genesee County. We continue to brief them on the proper personal protective equipment that they need to be issued and carrying and when they need to use that.
What about paying these people? Are they getting paid?
The two things, we're still putting our plan together on a department by department basis for the entire county as far as our regular 400 or 542 people. We're trying to seek clarification from the state as to whether or not, as we do that, our emergency services and our critical care people like health department, sheriff's office, EMS, and those people are or are not in what they consider our calculation of a 50% workforce goal of reducing or getting to, based on both state and federal legislation, what's either in place and or what is likely to be in place. No employee who is not working at their particular desk or counter or whatever will lose any pay. All people will be on paid leave throughout this issue, whether or not they're working at home, whether or not they are just at home, or whether or not they're coming in and cycling through our various operations. So there is no issue with regard to any employee working presently for Genesee County government not getting paid throughout this entire process. However, but like I said, particularly with FEMA, we don't know exactly what the 38 million or the 40 million the state's put in play, or the 38 million coming from the first outlay from the feds a week or so ago, whether or not that is going to be like with FEMA aid, which is for extraordinary expenses above and beyond your normal routine daily operations. So that's usually overtime, mitigation, and heightened response and things of that nature. Those are the current FEMA guidelines. I've not heard anything that's going to say any differently from that. As you do know, the state of New York and the Senate at the U.S. level and the House of Representatives are dealing with legislation that deals with the Medicaid issue as well as emergency aid. That has still not been, so to speak, finalized, and that is part of what we obviously as a county are paying attention to, and our state representatives and our advocates in Albany and NISAC in particular are keeping us apprised of where and when that may play out and how that will play out, very likely by the end of this week.
What do you have to say to other small business owners?
You know, I don't have much more to say than we got to roll with the punches. Nobody's asking for this. Nobody wants this. Nobody's really the cause of this from our perspective. But we're going to have to play it every day. I've been working with my people in regard to making a plan and figuring out, trying to forecast how bad it's going to be and what we can do on the expense side, because we know the revenue side's going to go down. So certainly we're thinking about it and planning it, but I don't know that I have a good answer for that right now.
Andrew, what do you say to the employees of a small to medium-sized business? They don't work, they don't get paid. If you work for Genesee County, it doesn't seem to matter. You're going to get paid no matter what you do.
I understand the concern. I am confident that we're going to be able to, from the federal level, mandate or fix some things. I've heard some things from the federal level that they are immediately going to start to send out some checks and try to help the people in that regard. Again, this is a bad situation, and your question emphasizes that. I understand that. We're going to have to get together and make sure we're doing everything we can to help the people that are going to be needing help, and that's going to be all of us at some point during this process.